Radical prostatectomy is one of the principal treatments for prostate cancer. And again, I'm going to talk about my experience with radical prostatectomy and my expectation for patients I care for. It's very important for this not to replace the relationship that you have with your physician. And it's also really important to ask your surgeon, who you may be contemplating having a radical prostatectomy with, what his or her experience is and what the outcome statistics you can expect in their hands. So a radical prostatectomy is basically a surgical procedure to remove the prostate, and in select patients to do nerve sparing as well as a pelvic lymph node dissection. The prostate's a small organ that makes semen that is at the base of the bladder, deep in the pelvis. Traditionally, when radical prostatectomy was really invented as a treatment for prostate cancer, that surgery was done as an open procedure. And as an open procedure, we mean a conventional incision was made in the lower abdomen, and a retractor was placed, and the prostate surgically removed. Open radical prostatectomy can still be done, and is done by many experts, and is a safe and effective form of treatment. With the advent of robotics, now about 15 years ago, many high-volume prostate cancer surgeons transitioned to performing that operation robotically. And I'm one of those surgeons, and I have been doing robotic prostatectomies since the early 2000s, now about 17 years. Why did I transition to robotic prostatectomy? I think it's a more reproducible operation in my hands. The magnification is fantastic, the precision is wonderful, the blood loss is less, the pain is less, and the speed of recovery is less. And I think when we looked at our urinary control statistics, meaning how many of our patients recovered urinary control completely and relatively early, our data looked better having a robotic prostatectomy than open. So I transitioned to robotic prostatectomy essentially exclusively over 13 or 14 years ago. For select patients, we'll still do the operation open. So let's talk about robotic prostatectomy. So the surgery itself requires 5 small incisions. One's at the belly button, that's the largest incision, it's about 2 or 3 centimeters, and then 2 each on the sides, small puncture wounds on the side of the abdomen. You do have to be under general anesthesia. That surgery takes me about 2.5 hours, depending on whether I'm doing a pelvic lymph node dissection. The chance of significant blood loss is very low. My last blood transfusion was over 500 cases ago, so a blood transfusion rate well under 1%. So we do not even make pre-donate blood products here at UC San Diego Health for most patients for that procedure. When the patient wakes up in the recovery room, they have small bandages on their abdomen and a urinary catheter in their penis draining urine from their bladder. And that urinary catheter stays in place 6 or 7 days, depending on which day we schedule your follow-up visit. Most people get on their feet the day of surgery and walk because that makes them feel better. Most patients don't have very much pain after surgery. We try and minimize the use of narcotic pain medication. And many patients take no narcotic pain medicine in the postoperative period. Most patients feel well enough to be discharged from the hospital the day after surgery. So many patients go home within 24 hours of arrival in the hospital. And it's not because we're pushing them out of the hospital, they're feeling well enough. What most patients experience at that point is some difficulty with urinary control. So one of the risks of a radical prostatectomy is urinary incontinence. And what that means is leaking urine when a man coughs or sneezes. And right when that catheter comes out a week after surgery, I would say most men experience urinary leakage, and you should expect some level of urinary leakage. We ask men to bring a pad to protect their underwear when they have that catheter removal visit. Most patients will recover complete urinary control within weeks to months. A small percentage of patients struggle with recovery of urinary control, and even a year after surgery are still wearing a pad. If you ask what's my data, and patients always ask, well, what's your outcomes, Dr. Kane? It really depends on the age and health of the patient. The younger and fitter the patient is when we do radical prostatectomy, the lower the risk of urinary incontinence after full recovery, and the quicker the speed of continence. So if we look at my pad use for 70-year-old men a year after surgery, about 10% of patients will use at least a pad for protection at 1 year if they're around 70 years of age. If we look at 60 years of age, it's well under 10%, it's around 5%. If you look at men in their 50s, it's lower yet. Severe incontinence is about 1 to 2% in our series, and that means men that are seeking treatment for their urinary incontinence even after a year after recovery. So continence recovers for about a year, and then it reaches pretty much a plateau. Age-related, somewhat related to health, and somewhat related to surgeon technique and surgeon experience. The other main adverse effect of surgery is changes in sexual function. So pardon me for the next part of the video, I'm going to speak frankly about sexual function. A man's sexual function really is complicated. It has a lot to do with the nerves around the prostate. When we talk about nerve sparing, those nerves are autonomic nerves just adjacent to the prostate that have to be carefully preserved. And we can't always do that if a man has a more aggressive prostate cancer. So you should speak to your surgeon about whether you're a good candidate for bilateral nerve sparing or nerve sparing on both sides. But if we can preserve the neurovascular bundles, then men have good potential for recovering the ability to have a good erection after surgery. Typically, the ability to have an erection after surgery is injured and then recovers over a period of time. That recovery can take 18 months to 2 years, and the recovery is not as brisk or complete as the recovery of urinary control. We often will advise men to be on Viagra, Cialis, or similar medications in kind of a plan of sexual rehabilitation if they're trying to recover sexual function. So those nerves that we talk about, nerve sparing, really have to do with the ease and completeness of an erection. When a man has his prostate removed, the prostate makes semen. So a man can expect that after surgery, when he orgasms, even if everything's working perfectly, no semen will come out. And that's a permanent outcome after surgery. And finally, many men are fearful that if they don't have nerve sparing, they're going to be numb. They're going to not be able to feel their penis. And that's not true. The nerves that have to do with your penis's sensation are actually not injured during radical prostatectomy. Totally different set of nerves. So a man who has a radical prostatectomy should be able to feel his penis normally, should be able to have normal orgasmic function, meaning reach a climax. The nerves that we preserve have to do with the ability to have an erection, how easy it is to have an erection and maintain an erection to have sex. And that's the part that's injured and that goes through a period of recovery. Other things that happen during surgery or potential complications are injuries to adjacent structures like injuries to the rectum or injuries to the bowel. Fortunately, those are extremely rare, less than 1% for experienced surgeons. Typically, any of those injuries are recognized and repaired. Rare serious complications do occur, of course. The other potential complications is anesthetic risk, things like a heart attack, a stroke, a blood clot. Those can occur, but they're extremely rare. This is a safe and reproducible operation. Sometimes your surgeon will recommend prophylaxis, which means a preventative measure for blood clots. That is one of the more common complications after surgery, and sometimes we'll give even blood thinning medication in the weeks after surgery. And we'll essentially always recommend that you go for a walk every day and that you avoid things like long flights or immobility that can put you at higher risk of blood clots. We avoid those things for the month to 3 months after surgery to minimize that risk. One of the things that you should know is most patients go through radical prostatectomy and really have a safe and reproducible experience. It's one of the best treatments for prostate cancer. Is why men, are able or willing to put themselves through the additional experience. One of the nice things about having a radical prostatectomy is that we learn more about the cancer. We learn more about the grade and extent of disease, and we can very well prognosticate or predict what's your chance of future recurrence. After surgery, we can, if you're in a high risk of recurrence, we'll sometimes recommend additional treatment like radiation therapy or hormonal therapy. And those additional treatments can be given very safely after a man has recovered from surgery. So if we could predict the man was likely to need more than one treatment, then we would prefer to do surgery followed by radiation therapy or hormonal therapy rather than the other way around. If we've done radiation therapy or hormonal therapy and then a man has a recurrence, doing surgery after radiation is more complicated. So who's the best candidate for radical prostatectomy? I would say younger and healthier men, certainly with more than a 10-year life expectancy, with clinically significant prostate cancer, particularly higher risk prostate cancer, we now think are the best candidates for radical prostatectomy. So again, I don't want this to replace the information that you get from your physician. If you'd like additional patient resources, I recommend the National Comprehensive Cancer Network Guidelines, the NCCN Guidelines. We're an NCCN institution at UC San Diego Health and the Moores Cancer Center. I'm on the NCCN Guidelines Committee, and I think the patient resources are excellent. If we can provide any information for you, or if you'd like us to provide your care, of course, we'd be delighted to see you at UC San Diego Health. Good luck on your prostate cancer journey.